let's roll back a little bit to Queen's Park. This was a busy week down there, of course. It's unusual to have a summer session, but that's what started, of course, with the speech from the throne and the budget being reintroduced. But they weren't talking that much about economics. They were talking about healthcare. As the healthcare system and this government now deals with staff shortages, increased wait times, and temporary ER closures, experts are offering up solutions to try to fill the void left by the Conservative government's throne speech this week. Karen Rebo has some details.
There is no shortage of suggestions from experts and advocates as to what could help the system get through staff retirements, vacations, illness, and burnout. Nurses' unions are calling for training and registering more healthcare workers, including from other countries. They also want better working conditions, and they want the government to scrap the law that caps wage hikes for public sector contracts at 1% a year. The Ontario Medical Association is calling for the province to build publicly funded standalone health centres that can perform less complex outpatient surgeries. The doctors group says 22 million patient services were delayed during the pandemic, 10 million of which were surgeries and cancer screening procedures. Karen Rebo, The Canadian Press, Toronto.
So let's look at what's going on with there and a number of other issues with Queen's Park, too. And to do that, we're so pleased to welcome back to the program John Best, who is the publisher of the Bay Observer. John, great to have you back on the program. Hope you're doing well these days.
Doing well, Bill. Nice to be with you again.
Busy week. Like I say, we don't usually have a session at Queen's Park during the summer months, but here we are in the middle of it right now. I found it interesting that we've just laid all these stats out about what's going on with healthcare and closures in some ERs, especially in some small towns. Yet the Minister of Health and the Premier are both saying this is not a crisis, guys. No, don't overplay this at all. Is the public buying that, John?
I doubt it. I don't think anybody would say that we're not in a crisis mode. And even today, you pick up the Spectator, and they're talking about 5 people leaving Hamilton Health Sciences. These are people that operate the heart-lung machines when somebody's getting open heart surgery. 5 of them left for Toronto because they're getting more money down there. So, I mean, to suggest that there's no crisis, I think is, whistling past the cemetery. So I don't think anybody's going to buy that. I think the issue, though, is you get rhetoric as well that I don't think is overly helpful. The minister yesterday kind of got tangled up when she talked about, I don't even know if she talked about it, but somebody was reading the tea leaves in their comments and suggesting that she was talking about privatizing healthcare. Mm-hmm. And that just seems to be a red flag that really gets people upset. And yet, if you look at our current healthcare system, it's about 30% privatized as it is. And I did a little scan of some of the other Western countries, and in Europe, several of the countries, including France and Germany, have these hybrid systems where there's 100% publicly paid for services, and then there's supplementary insurance systems. So I think if I saw Mr. Tabbins yesterday saying it's the thin edge of the wedge. I think the discussion has to take place, at least to explore what it really means, and I don't think anybody really knows.
And that's the interesting element about this. I mean, if you want to get into political characterizations, what Peter Tabbins said yesterday was exactly what you'd expect an NDP leader to say. We're against that. We don't want privatization at all. And you would expect a Conservative government to say, yeah, we need to do that because there could be some economies of scale. So, those are the two polar ends of the debate here. So nothing new there. But I guess the concern here is, as you say, what's this going to look like if, in fact, they're going to do it? And I'm always skeptical, I guess, John, when a politician says everything's on the table. That kind of tells me sometimes that maybe they've already got a plan in the bottom drawer there and they're just waiting to pull it out.
Well, one of the biggest problems that the hospital system faces is the number of patients they have in the hospital that really don't belong there. They're stabilized, or they're at a point where they no longer need intensive care, but there's simply no place to put them. So, that's not a magic wand solution, but we certainly are well aware of the problem. I can recall many years ago, I was in hospital for a couple of days, and I was in a room with another patient, and he had been in there so long that he had a dresser brought in from his home. So like he was in there for the long haul.
Wow.
And it was just the people just sort of walked around. And I mean, this is somebody that clearly needed to be in a nursing home or a retirement home or something. Clearly did not need, was not needing to be in what would be an intensive care or a high needs hospital bed. And there he was. And that's in one of our hospitals in Hamilton. So there definitely is a problem with finding sort of that intermediate space for people that need care but don't need to be in a hospital. And I think that's going to be one of the big discussions down the road.
Yeah, no new ideas here. I mean, we know the formula here. You're absolutely right. They need to invest in home care. They need to invest in long-term care facilities, a number of situations like that. And that doesn't seem to be happening. So they're looking to go down this other road here with the privatization. It's going to be fascinating to see just what they try to roll out and how they're going to implement this whole thing. And first, importantly, I guess, is how we're going to react to it as a public. Another element that happened, and this seemed, John, like a whole hum thing. They have to elect a new speaker for the legislature, and it's something that has to happen. You have to have a referee there, and when you have a majority government, it's usually a government member. Ted Arnott was the guy last session. He ran for re-election. Doug Ford didn't want him, and he had his own candidate. She lost. Arnott is back in there. And hell hath no fury, like a premier that has been ticked off. He's taken privileges away from, I guess, just about everybody in his caucus right now because he didn't get his way.
Well, it's probably about the only opportunity that ordinary members have to express some independence from the whips. And the maddening thing for Ford is that he can pretty much guess who were the, and I did the math, and assuming that everybody was present at that opening session, there were at least 21 members of his caucus that had to vote against his wishes in order to retain Mr. Arnott in the speaker's chair. So, you can kind of figure out who they are, who's been kicked, who's been excluded from cabinet, who hasn't got a hope in hell of getting into cabinet. Is there anybody that didn't get a parliamentary assistant job? So you got a rough idea who they are, but you can't prove it. I mean, it doesn't mean that it's a palace revolt, but what it does mean is that there's a certain amount of discontent in the ranks. And when I don't care if it's a parliamentary caucus or a newsroom or a factory floor, if you've got, I think he's got almost 80 odd members, there's always going to be a faction in any workplace where people are not happy. And this is the one opportunity that many of them have for their entire term of office. This will be the one opportunity they had to sort of express themselves, so to speak. So, I'm sure he's angry. I saw him after the vote was taking place. He was participating in the standing ovation that Mr. Arnott got, but it was sort of, in his case, more like golf applause than anything else.
And then, of course, they went into their caucus meeting, and he has canceled international travel for the caucus. Requests to be absent from the legislature have been denied automatically, and phones have been locked away. So they've been bad kids, and he's taken away their privileges.
Yeah, that's unfortunate. That is almost the kind of petulance you'd expect from a Trump. I've always resisted these comparisons of Ford with Trump because I don't think there is much to compare the two. But when you do, sort of peevish things like that, it's not helpful. And he's in his second term now, so I think he's less concerned about how happy people are, and that'll not only be within his caucus, but also to a certain degree the public as well. I think the thought is this is his second term, and there's going to be a lot of sort of sweeping actions taken. We're already hearing about some of them, certainly in this whole housing piece. He's with the strong mayor system. And
Yeah, let's talk about that. I'm glad you brought that up. I checked that off on my list here.
yeah,
It's a piece of legislation that was introduced, and this is not a new idea. It's been talked about for years. Dalton McGuinty kind of wanted to do that, but David Miller, who was the mayor of Toronto at the time, said, "No, we're good here. We don't need that." And basically, as we've talked about, at least conceptually in the past, it gives the mayor of the city extra powers. They can appoint the chief officers, they can appoint the committee chairs, and fire them too if they want in situations like that. I'm surprised. Like I mentioned yesterday in my comments here, I mean, I was on council for 9 years, and I can see that there's some benefit to something like this because of the inertia on a lot of these councils and the vote trading that goes on. But I'm surprised that this is mixed reaction. A lot of people just don't seem to like the idea. What are your thoughts on it?
well, I'm kind of with you. I mean, I think what it does mean is that when we're selecting a mayor, we've got to really now put on our thinking caps and look very closely at who we're electing, because it will be hard to muster a 2/3 if that ends up being the number. I'd feel more comfortable with something like 60%, but I'm not sure it makes that much difference. But it's still, it would take a pretty serious revolt on the part of a council to overturn the mayor's wishes. I do like the idea, frankly, of the mayor having more say in terms of senior staff, because I think what we're looking at here with the Red Hill Inquiry, at the end of the day, what we're seeing there is a lot of disconnect between council and senior staff that I think would be less likely to happen if it was understood that the mayor could hire and fire department heads. And hopefully that wouldn't become somebody abusing that process. But I kind of like the idea of a mayor then being able to shape his or her own administration more than right now. It's one vote on council.
Well, it's like a prime minister gets to choose a staff, and the president of the United States gets to choose their staff, and on it goes. So I see some merit, but with that, of course, comes more responsibility. That means, if this whole thing tanks, it's on the mayor. I mean, because they hired these individuals. You can say right now, yeah, well, that finance guy, I inherited him or her, when I got the office, so I'm going to have to do what I can. I mentioned though, by the way, it's going to be a test case in Toronto and Ottawa first. I'm assuming John Tory is going to get reelected, and I can see Tory fitting into that structure. I don't know who's going to be the mayor of Ottawa because Jim Watson's not running again, but I'm kind of glad that Hamilton is not on that list right now, because I don't think we're ready for something like this. I think we've got some growing up to do with councillors and attitudes before we can adopt with a system like this.
Yeah, and there certainly was a strong hint in the throne speech that the thought is that this will extend to the other large cities in the province. The question, I guess, is will it happen in this current council term that's coming up, or would it be something that would be implemented in the next council term? But either way, if there's any chance that it's going to happen in this council term, I think it just makes it more behooves voters to take a look at people and say, who could fit that role now, should it come along, say, in the next year or two.
Yeah, and that's the concern I think an awful lot of people would have if it were to be implemented here. There's with it, as I say, it's that responsibility, and this now you're not just asking the mayor to be the chief magistrate of the city and the head of council. You're asking them to actually set the course for what's going on. And I know just about everybody that wants the mayor thinks they can do that, but under the current system right now, for instance, in Hamilton and London, the mayor's one vote. I mean, they can have a lot of influence, but when the hands go up, yay or nay, there's not a whole lot the mayor can do about that. A strong mayor can actually move an agenda forward if they have that kind of talent anyway. And that's the whole thing. You've got to find somebody that has that skill set.
Well, and I think being able to, it's one thing to come in with your mayor staff, the staff of the mayor's office, which they all get to do, but being able to come in and actually shape the senior bureaucracy, I'm sure it's scaring the hell out of any city employee that's listening to this right now. But You look at New York. I think we talked about this in New York. The mayor even appoints the chief of police and also is in charge of education. So imagine having all that on your plate and being able to move those key people in and out as mayor. Now, New York is like a country, so population-wise, and I don't think we can make any real comparisons here, but there certainly are systems where this is the way it works. And Buffalo would have the same kind of system with a strong mayor, and that's a city more in line with Hamilton's size. So it's happening elsewhere. I don't think we have enough evidence to know whether it's working well everywhere or not, but it's an interesting concept, and I think Ford comes at it from the unique position of having sat on a council, seen the inertia, the grandstanding, the virtue signaling ad nauseum, and so he did two things. He got rid of half of them, although I don't think he changed the overall political complexion of the council that much. But it's clear he likes tinkering with municipal government. So
sure
here
does.
we go. Yep.
Yeah. John, we're out of time. As always, thanks so much for this. Have a great weekend, and we'll talk again next week. I'm sure there's a lot more about the stuff we just talked about here, too. Take care.
Yes. Yep. Thanks, Bill.
John Best, publisher of the Bay Observer.